Thank you, Chair, and good afternoon to all of our witnesses today. Thank you so much for taking the time to do this, because I think it's really important. So I want to cover just a couple of areas, and I might start with the building itself. And obviously most of us read through the building reports in detail, and we can see ourselves the very significant work that would have to be undertaken. I just want to take a moment to understand the timeline of this process and I guess how we got here. So my understanding is the inspection process that we're looking at the moment, the first version of that was 2016, where there were 14 areas of non-compliance recorded. And for the premises, which is Regulation 22 that we're discussing today, I guess, it was considered non-compliant, and there was a moderate level of non-compliance. By the way, these levels of moderate or compliance seem to change every year, which isn't great in terms of trying to follow inspection reports. Sometimes it's related to risk rating, and sometimes it's around compliance. But anyway, so in 2016, it's rated as a moderate non-compliance. It speaks, we won't go through all of them. It speaks about lack of communal space, that the 3-person rooms weren't of a suitable size, the use of keys, and the requirement was that that there was an ask that it requires improvement. And there was also, it was pointed out that there is no maintenance budget, or there was no maintenance budget within the centre. In 2017, it seems that Regulation 22 was considered compliant. And under the report, it goes through and says that the quality rating is satisfactory, the building inside and out, or internal and external, is in a good state of repair, there is ample personal space. In 2018, it's considered non-compliant again. It's moderate non-compliance. It's not in a good state of repair internally or externally. I have to say, a change of external bad repair over a year is unusual, just speaking from a professional point of view. Buildings degrade over a long period of time, so that's interesting. And particularly, and this seems to come up in a number of reports, the toilets and bathrooms are not in good repair. And then in 2019, we're back to Regulation 21 being non-compliant, but the risk rating is considered low. And there is a requirement for significant renovations. And again, some of these regulations or renovations have been done, and the toilets and the bathrooms are considered to be clean, hygienic and in good repair. So I have a number of questions around that timeline. First of all, in 2019, the report states that there was significant renovations undertaken. Could you outline what those significant renovations were and what the cost of those were?
I don't have that information to hand here, Deputy. I can certainly send it in to you afterwards. Okay,
so there's also a reference to funding granted for a new wet room. Was that work undertaken?
I'll have to come back to you about the specifics about that particular wet room. I'll include that in my response.
Okay, so the report says there was funding sought and granted for a new wet room, and if you could also supply us with the cost of that funding, and obviously if it was used. We're trying to work out whether that wet room was actually built. The report says that would give a total of 3 showers consisting of 1 assisted shower, so that seems to be significant work. It also says that that in the 2020 report, it says that all the lighting was upgraded to LED standard and all the fans in the bathrooms were retrofitted. So I presume that work was undertaken. Do we have a cost for that?
I'll forward that cost to you as well. Yes, I don't have it to hand.
Okay. Would you like to make a comment about the fact that all the risks outlined in the previous building reports were categorised as low to medium?
I think that, yes, there were, and I suppose in reality the building itself, and I think it's important that I would just kind of outline it, is that the building itself wasn't necessarily coming up in lights, for want of a better phrase, in terms of having significant issues. And there was an ongoing, as there is in any of these particular buildings, there is an ongoing spend from a minor capital perspective and an ongoing maintenance programme to pick up on specifics. I think the reality is that when we were, at the same time, the condition of the building, the fabric of the building, and I suppose really the layout of the building is certainly of concern and was always of concern. So you haven't large room sizes, and it can be quite a cramped space, etc., especially for people with significant levels of dependencies. And our own estates department then sought external review from external professionals with regards to same. And I think you've referenced earlier, Deputy, those reports which were really centring around the prevalence of asbestos, and also, I suppose, the fire-related issues that were there. And they also themselves then, I suppose, reached a conclusion, which we accept absolutely, that to do works on the building, even on a phase basis, of the nature that would be required to bring it to the modern design and the modern requirements that should be expected by the people who would reside there and into the future. The building itself is just not fit for purpose for that particular purpose. So I think you point earlier to ongoing various issues. There has been an ongoing issue, I suppose, around privacy and dignity, and again, that's the design issue really around the building. Obviously, the building is there since the early 70s. So we are talking about a building that was of its time, which is 50 years ago. And, I suppose, in any of our renovations that we try to do, whether that's a new build, a refurbishment or whatever, it is actually to bring it up to a standard that you are actually protecting people's privacy and dignity, that you are creating adequate space for circulation, adequate space for privacy, adequate modern build, really, to be honest with you. And it was in that context that we were looking at, I suppose, a significant refurbishment of the building so that we could deal with these issues and also what would be the expectations of the residents.
Are there any other residential units in the Cork Kerry healthcare area that would have a moderate non-compliance in Regulation 22 for 3 years in a row?
There are a number of centres across Cork and Kerry where we have ongoing works with regard to our ongoing plans with regards to modernisation.
I don't mean to cut across you. I'm just very aware that other people will probably want to get in to ask questions. Would they have reports that state that they are between a low and moderate non-compliant level under Regulation 22?
I'm sure they are, and I can actually supply some of that to you, and I'll certainly
that would
check
be very useful. Is the HSE planning to close those?
I think the point would be that our view would be that we would want to have a plan, really, which will see the modernisation of a lot of our residential services and to ensure that we are providing the appropriate service in appropriate setting.
You can absolutely see, though, from the point of view of residents and of residents and families, that if it isn't flagged in the annual reports, that leaves everybody who's in a residential unit in this country in a difficult position. I'm just aware that my time is being eaten up, so I'm going to keep going. In terms of the asbestos testing, in 2019 there was a significant report on asbestos. You mentioned there that there was a further undertaking, a further inspection in February. Was that a more complete asbestos report?
Not specific to asbestos. I'm saying that our.
Is there any further asbestos report available since the October 2019 report?
I don't have it to hand, but again, I'll just check in case there is with our States Department.
If you have it, could you pass it on? Because otherwise, the asbestos report that we're looking at is from 2 years ago, and the question then becomes, why are we here 2 years later with a 4-month window to move people out of their homes? Can I just ask, finally, I'm sure I'm nearly out of time, in the 2020 report, there's a statement that capital funding has been approved for a major refurbishment. The estates have been engaging with the design team, and the overall project has been costed. Detailed drawings are attached as a supporting document. I can't actually find that information. what is the cost? What is the total costed project as proposed for the refurbishment before this decision was taken?
I don't have it to hand. I can send that on to the committee.
And finally, if I have a chance, has the Hse plans for the site? We haven't specific plans for the site. We certainly recognise the value. We will certainly, as I said in the opening statement, be looking at our the healthcare needs of the area and to identify any particular needs that would be there, which would be well served with some development on that site. Have you undertaken a valuation of the site?
Evaluation of the site itself? No, I haven't.
Yeah.
No, not around.
Sorry, Chair, I'm aware I'm over time.
Thank you, Deputy Horgan. And our next speaker is Senator. I think we're going to move on now, and I will come back to Deputy Neasa. Horgan, I know you have some more questions.
Thank you, Chair. It's me again. And I had a number of questions there that I didn't quite get to, but it does speak to Deputy Stanton's previous points around the timeline, and I'm just trying to understand how this timeline came to be and how we got here. So just to be clear, the decision was made in June, the residents and families are told in July, but the original set of or the newest building report or estates review was done in February. Is that correct?
I suppose there's in terms of the reports that we've got, I suppose it was on the basis of a report that was provided to us from estates, having taken account of the number of reports that you'll be aware of, Deputy, that it was on the basis of that the decision was made, and that was made available to us on the 18th of June.
Okay, but the estates section compiled that report in February, you were saying earlier.
I'm not sure what I said about that particular piece, but I can say to you that it was the 18th of June that we got the culmination of the various reports that they had undertaken, which was inclusive of the fire report the earlier report, which you referenced, I think, earlier, with regards to the asbestos, and indeed their own condition survey as well.
And was there new information or surveys undertaken between December 2020, when the building inspection was undertaken, and the report that you received in June?
I suppose the simplest way of saying it is that the fire report, the earlier report, as I said, with regards to the asbestos report, and the general report that was undertaken by estates itself, it's the culmination of that we acted upon. So to answer your question,
my question is, was there new surveys between December 2020 and June 2021? Were there new building surveys? Did somebody go into the building and undertake new testing or new surveys?
Yes, I mean, estates is what I'm saying. Our own estates department, on the foot of the information that they had, yes, they did.
So, sorry, just to be clear, they compiled that report in that period, or they undertook new surveys?
They compiled that report in that period.
Okay. And in that period, was there a standalone new fire inspection done and a standalone new asbestos report and set of testing done?
I'll come back to you with regards to the timeline and the detail of that, of what you've asked me with regards to the specifics around the asbestos and the fire report.
Okay, because it is really important in terms of the timeline. The last significant piece of report, which in terms of asbestos, which looks like it reviewed around 1/6 of the building from the plan that's attached to the end of the report. It looks to me around 1/6 of the floor area, which would be around standard, found that there is asbestos present. It was in relatively good condition, as anyone who works in the area would know. If it's disturbed, it's of particular concern. But that, of course, dates from October 2019, which means that if it was of particular urgency, requiring, an immediate move out of residents, to not take action on that October 2019 report for almost 2 years, is something that really we'd need to follow up within the HSE if there are other reports. And that brings me to my next question. Are there other facilities that have received similar asbestos reports as that?
I suppose just to be clear about the asbestos report. The asbestos report was being done as a, and I think you are asking me a very specific question from an engineering perspective that I'd ask my estates colleagues to provide a report to you on. But my understanding of it is that the asbestos report was a basis for if works are to be undertaken in the building. This is an initial report with regards to asbestos, yes, and indeed what might be the kind of disruption that might be required as well, and what would be the care and issue that would be to deal with it. So I think that's just important just to say that.
Okay. I noticed earlier in the session there was a discussion around St Stephen's Hospital by Deputy Sherlock, and I have to say I agreed with a lot of what Deputy Sherlock said. I thought he spoke very well. And I want to stay on that issue of St Stephen's Hospital. I have requested us now, just to say that, like all of the residential facilities that we have in this country, that was also reviewed, and the most recent review is 2020. And unlike Owenacurra, under Regulation 22, St Stephen's premises was noted as non-compliant, but that risk rating was high, unlike Owenacurra, which was considered low. So you are not ruling out that residents will be moved or could be moved to St Stephen's Hospital? Is that correct?
You're
not ruling that out?
Oh, I'm not ruling it out, no, but I suppose just... could I just
sorry to cut across you, I just have a really quick question because I know there's other people who want to get in. I've requested building reports on the long stay and acute wards in St Stephen's Hospital since August, and I haven't received those reports. Could you give me an undertaking to send those reports to me?
We can indeed, and just to answer to add to the piece just a little earlier, I just had pains to say that it is a residential centre that is registered with the Mental Health Commission, and at this point in time, so it's just important to say that, and it has admission. There is admission to that set of units in Stephen's, which is an acceptable thing from Mental Health Commission's perspective.
St Stephen's includes dorm-style settings, doesn't it?
It definitely does, absolutely, and it is certainly a set of units that we are currently actually looking at to see can we upgrade in the interim, and it certainly would be requiring a replacement as part of our overall capital plan development.
Could you give an undertaking to the families of the residents currently in Owenacurra that anyone who is in a single stay room in Owenacurra will not be moved to a dorm setting in St Stephen's?
I think, and I hear what you're asking me, but I just think to be fair and to be staying with the process has an assessment process. There's a discussion that's ongoing, and with the residents of Owenacurra. And I think that saying anything here about where people might be placed or not placed, or what might be appropriate or inappropriate, would be unfair to them.
Can I ask how many persons are going to nursing home care of the 19, or a percentage of that 19, if you'd be more comfortable answering it that way?
We're looking at about 40%. Sorry, my apologies. It's 5 individuals where there is consideration of nursing home care.
5 individuals out of 19. And would those nursing home placements include single stay rooms?
The nursing home accommodation does have some single bedrooms. Again, I'd have to look at the exact units. So there is a large proportion of single rooms, but there also are some rooms in nursing homes that have 2 people occupying rooms.
But can you confirm for the families of residents in Owenacurra that those who have been in single stay rooms in Owenacurra won't be moved to dorm-style rooms in nursing homes?
Again, as Michael Fitzgerald has stated, we will be fully discussing any proposal regarding...
You can't give that undertaking right now?
So at the moment we're in the process of looking for approval for nursing home placement. So we're in that process at the moment, but we will fully discuss the options with individuals.
Are the nursing home placements you're looking at in private or public units?
So again, we're looking at where people would like to go. So we're looking at all options at the moment.
And finally, I suppose it's a question for yourself. Earlier you were talking about, you know, the idea that many of the individuals who live in Owenacurra were not planned to live there in the long term, and that for many of them a high dependence hostel would be appropriate, or some kind of community setting. How can I phrase this? Many of the people in Owenacurra would have lived there for a decade or more. Is there a clinical concern around moving people who have lived in a residential setting for more than a decade into a more community setting or a high dependence hostel?
So again, just to be clear, every individual will be assessed individually to determine what level of care they require. Some individuals will require ongoing continuing care setting, and in order for that to happen and to cause the least amount of stress, it is important that staff that are well known to the individual would follow those individuals to assist them with that transition period.
Okay, thanks, Chair.